Hello and welcome to BYJU'S IAS. Let's get started with the analysis of today's The Hindu newspaper. See, there are very few articles in today's newspaper that are worthy of discussion, because most of the articles are related to the COVID-19 pandemic, and we have already discussed these topics multiple times over the last few weeks. So in today's analysis, we shall take a look at just two articles. First, we shall look at a column from page number 7 that deals with the topic of compulsory licensing. And second, we shall take up an article from page number 11 that deals with a maritime dispute between China and Indonesia over the Natuna Islands that are located in the South China Sea. See, the writer of this column makes a case for compulsory licensing for drugs that have the potential to cure COVID-19. But first, let us understand the context in which the column has been written. See, we all know that the World Health Organization has already declared COVID-19 as a pandemic. It means that this disease has already spread to multiple countries around the world, and it has the potential to affect a large part of the global population. But despite being declared as a global pandemic, the United States has classified COVID-19 as just an orphan disease under the Orphan Drug Act of 1983. This legislation exists in the United States in order to incentivize drug manufacturers and pharmaceutical companies to develop cures and vaccines for orphan diseases, which essentially refers to a rare disease. See, a rare disease which affects a very small population may not motivate the drug manufacturer to invest in research and development for developing a cure or a vaccine against the disease. Because for manufacturing drugs, massive investments are needed in research and development, and this R&D cost may not be recovered if the affected population is very small. So in the case of such rare diseases, the drug manufacturer may not be motivated to develop a cure, and this leaves the affected population vulnerable. So in order to promote the development of drugs for such rare diseases, the United States incentivizes drug manufacturers and pharmaceutical companies by declaring those rare diseases as orphan diseases under the Orphan Drug Act of 1983. Under this legislation, the criteria for declaring a disease as an orphan disease is that if the affected population is less than 2 lakh people in the United States, or if the investment in research and development cannot be recovered within a reasonable time period. In such cases, the US government can declare the disease as an orphan disease, and this will help in providing incentives to the pharmaceutical companies. And subsequently, the drug developed by the pharmaceutical company will be given the status of an orphan drug, and this will allow the drug manufacturer to retain exclusive market access for 7 years. Then upon this, the drug manufacturer will receive a set of financial incentives from the US government for the production, manufacture, and sale of the drug. This provision will help in promoting the system of patents and the intellectual property regime in the United States. This provision will help in incentivizing the drug manufacturer and help him recover the investments that he has made in research and development, and thus it will help in protecting and promoting the cause of innovation. But despite these benefits, the patenting system can affect the availability and affordability of essential drugs, because then the patent holder will have exclusive control over pricing and ensuring the availability of the drug. This will make essential drugs very expensive, unaffordable, and inaccessible to the weaker sections, especially in developing countries and least developed countries. So this concern has come up with the decision of the United States government to declare COVID-19 as an orphan disease under the Orphan Drug Act. Subsequently, the US Food and Drug Administration, or the FDA, which is responsible for approving drugs, has declared remdesivir, which is an antiviral drug developed by Gilead Sciences for treating Ebola, as an orphan drug. See, we have discussed over the last 1 week that remdesivir is an antiviral drug that failed to cure Ebola. But now, it is being considered as a potential drug to treat COVID-19, along with other anti-malarial and anti-HIV drugs. That's the reason why remdesivir, developed by Gilead Sciences, is a part of the solidarity trial that is being conducted by the World Health Organization. But interestingly, as soon as the Solidarity trial began, the US FDA declared remdesivir as an orphan drug, and this has led to concerns that the US government is misusing the Orphan Drug Act in order to benefit American pharmaceutical companies even during this time of crisis. So the question is the United States justified in classifying COVID-19 as an orphan disease, even though it has affected more than 8.5 lakh people and killed more than 42,000 people around the world? In the United States alone, around 1.8 lakh people have already been affected, and the number of cases are increasing exponentially. So this has led to questions over the classification of COVID-19 as an orphan disease and the classification of remdesivir as an orphan drug. But to be fair, Gilead Sciences has already requested the US FDA to revoke the orphan drug status because it wants to make the potential cure more accessible and affordable, considering the scale and the impact of the COVID-19 pandemic. But despite this, the writer raises questions over the questionable track record of Gilead Sciences when it comes to ensuring affordability of essential drugs. In the past, Gilead Sciences has been accused of adopting an exorbitant pricing policy for essential drugs against hepatitis C and HIV. It had even suspended the availability of affordable drugs under its compassionate use program by citing logistical issues. But there have also been instances where Gilead Sciences has worked towards ensuring accessibility and affordability of essential drugs. For example, it included its anti-HIV drugs under the medicines patent pool in order to make it more accessible and cheaper. It had reinstated the compassionate use program for children and pregnant women. It has also transitioned into the expanded access program in order to provide cheap and affordable drugs to patients who are severely ill. But nevertheless, the writer expresses concern over the profit motives of the US government and pharmaceutical companies, and she calls upon developing countries such as India to be wary of their motives. Hence, the writer is calling upon the Indian government to issue a compulsory license to Indian pharmaceutical companies if the Solidarity trial shows that remdesivir can be successfully used as a cure against COVID-19. So this brings us to the topic of compulsory licensing. So let us quickly understand what is compulsory licensing. See, when a government issues a compulsory license, it authorizes even a third party to produce patented products or make use of patented processes without the approval of the patent holder. Basically, with regard to pharmaceuticals, compulsory license allows third-party pharmaceutical companies to produce generic drugs. This extraordinary provision allows generic drug manufacturers to make use of same APIs or active pharmaceutical ingredients and same formulas as found in the patented drug without obtaining approval from the patent holder. Such a compulsory license can be issued by any government while dealing with a public health emergency or a national emergency, and it will help in bringing down the cost of essential drugs by producing generic drugs. The provision of compulsory licensing has been recognized by the World Intellectual Property Organization, and it has been contained in WTO TRIPS, that is WTO's agreement on trade-related aspects of intellectual property rights. In the Indian context, compulsory licensing has been provided under the Indian Patents Act of 1970, and these provisions can be found between Section 84 to Section 92. The writer is calling upon the Indian government to invoke the extraordinary powers that are granted under Section 92 of the Indian Patents Act and issue a compulsory license to Indian generic drug manufacturers if remdesivir turns out to be a successful cure for COVID-19. See, under Section 84 of the Indian Patents Act, any person or any organization can approach the controlling authority and request for the grant of compulsory license if these three conditions are met. A request for compulsory license can be made if the patented product has failed to meet the reasonable requirements of the public. Compulsory license can be requested if the patented product is not available to the public at a reasonably affordable price. It can also be requested if the patented product has not worked in the Indian territory. Apart from this, even the Government of India enjoys extraordinary powers under Section 92 of the Indian Patents Act, through which it can issue a compulsory license to domestic manufacturers during times of national emergency, public health emergency, or extreme urgency. This provision allows the Government of India to promote the production of generic drugs, especially during times of emergency, and bring down their prices and ensure that they are available to the public at a reasonable price. The first time that India issued such a compulsory license was in 2012, when a compulsory license was given to an Indian generic drug manufacturer known as Natco Pharma. Through this compulsory license, Natco Pharma was authorized by the Government of India to produce the generic version of Nexavar, which is a patented anti-cancer drug developed by Bayer Pharmaceuticals. See, Nexavar is used for treating kidney cancer, lung cancer, etc. But the patented version is very expensive, and it costs around 2.8 lakh rupees for 1 month's dosage. So in order to bring down the cost of this essential drug, the Indian government issued a compulsory license through which Natco Pharma produced the generic version of Nexavar at just 9,000 rupees per month. So compulsory licensing basically helps developing countries such as India to bring down the cost of essential drugs and ensure that they are accessible and affordable for the weaker sections. But this provision always brings developing countries into a direct conflict with the developed countries. For example, India's patent laws and its application of compulsory licensing has always been challenged by Western countries such as the United States and the European Union, which are looking to protect the interests of Western pharmaceutical companies. Now let's take up the next article from page number 11, which deals with the maritime dispute between China and Indonesia over the Natuna Islands that are located in the South China Sea. See, the Natuna Islands is an archipelago of islands located in the South China Sea, and it is located at the edge of China's 9-dash line. We have discussed in previous sessions that China claims a large part of the South China Sea, and through its so-called 9-dash line, China has directly challenged the territorial sovereignty of a number of Southeast Asian countries, including Vietnam, Malaysia, Indonesia, Brunei, and Philippines. One such conflict is over the Natuna Islands, and it is disputed between China and Indonesia. See, these maritime claims of China violates the laws laid out by the United Nations Convention on the Law of the Sea. Even though its claims violates international law, China has adopted an aggressive strategy in the South China Sea, and it remains adamant over gaining control of the area under the 9-dash line because of the strategic and economic significance of South China Sea. See, China holds this region to be of extreme significance because more than 30% of the global trade passes through the South China Sea. And this region is also said to be extremely rich in resources such as oil, natural gas, and fisheries. That's the reason why China has directly challenged the maritime claims of these countries, and it is even willing to question their sovereignty over their exclusive economic zone, even though it violates international law. This article refers to the presence of Chinese fishing vessels around the Natuna Islands, and they are escorted to the region by none other than the Chinese Navy and the Coast Guard itself. These Chinese fishing vessels resort to mechanized bottom trawling, which has depleted the fisheries in the region, and it is affecting the economic interests of Indonesia's fishing industry. Over the last couple of months, tensions have increased between the two countries, and in January, Indonesia's President Joko Widodo even visited the Natuna's Islands, and he has deployed the Indonesian Navy and the Indonesian Air Force into forward positions. But the very next day, China sent out an aggressive message to Indonesia by sending fishing vessels to the region which were escorted by its Navy and the Coast Guard. But right now, as Indonesia is struggling to deal with the COVID-19 pandemic, China has started to exert greater military pressure on Indonesia in order to assert its claims over the Natuna Islands. Now let's take up the practice questions. Which of the following are savings cum tax saving instruments in India? Is it national savings certificates, or public provident fund, or life insurance? Amongst the given options, 1 and 2 are correct. Option D is the right answer. See, life insurance or for that matter even health insurance, are definitely tax saving instruments, but it is not a saving instrument. Whereas the NSC, which is run by India Post, and the Public Provident Fund, they are savings cum tax saving instruments. This question has been asked because according to this article on page number 1, the Ministry of Finance has cut the interest rates on NSC and PPF. And also note down that these saving schemes fall under the small savings scheme category, and the interest rates are regulated by the Ministry of Finance, and it is announced on a quarterly basis. Now let's take up the next practice question. Which of the following statements are incorrect? The Andaman Islands are home to 4 Negrito tribes, which includes the Great Andamanese, Onge, Jarawa and Sentinelese. The Nicobar Islands are home to 2 Mongoloid tribes, which includes the Shompen and the Nicobarese. Both the statements are correct. But since the question is asking you to identify the incorrect statements, the right answer would be option D. Neither 1 nor 2 are incorrect. This question has been asked because according to this article on page number 4, the administration of Andaman and Nicobar has started to take a number of precautionary measures, and it has deployed heavy security in order to protect the indigenous tribes of Andaman and Nicobar after the COVID-19 outbreak has been reported in the Union Territory. Now let's take up the next practice question. Which of the following statements are correct? The UNDP, or the United Nations Development Programme, is funded entirely by voluntary contributions from UN member states. It was one of the main UN agencies involved in the development of the post-2015 development agenda. It publishes the annual Human Development Report. All the 3 statements are correct. Option D is the right answer. See, the UNDP is a program of the United Nations. It is funded entirely by voluntary contributions of its member states. It publishes the popular Human Development Report, which contains the HDI index of all the countries. And it also played a key role in the development of the post-2015 development agenda, which is nothing but the Sustainable Development Goals. This question has been asked because according to this article on page number 10, the export of around 90 tons of medical protective equipment from India to Serbia under a UNDP program has become controversial. See, as soon as the COVID-19 outbreak occurred in India, the Indian government had banned the export of all protective equipment. This was done in order to ensure that there is adequate domestic supply of masks, gloves, etc. But despite this ban on the export of medical protective equipment, around 90 tons of it has been exported to Serbia under a program which was funded by the European Union and the UNDP. Now let's take up the next practice question. Which of the following statements are correct? Under the MP LAD scheme, each MP has the choice to suggest to the district collector for works to the tune of 5 crore rupees per annum to be taken up in his or her constituency. This fund is available to MPs from both the Lok Sabha and the Rajya Sabha. The Rajya Sabha members of parliament can recommend works in one or more districts in the state from where he or she has been elected. This fund is not available to nominated members. Amongst the given statements, the 4th statement is incorrect. See, the MP LAD scheme was started in 1993 and it falls under the Ministry of Statistics and Program Implementation. Under this program, 5 crore rupees per annum is provided to each MP, and they can use this fund to sponsor developmental work in their respective constituencies by working with the district collector. This fund is available to all the MPs, that is MPs from both the Lok Sabha and the Rajya Sabha, and it is available for the nominated members as well. In the case of nominated members, they need to select one state in the country, and within that state, they can use the fund to sponsor developmental works in one or more districts. So since the 4th statement is incorrect, the correct answer is option C. This question has been asked because according to this article on page number 9, members of the Rajya Sabha have decided to contribute 1 crore rupees out of their MP LAD funds in order to combat the COVID-19 pandemic in their respective constituencies. Now let's take up the next practice question. Hand in Hand is a joint military exercise between India and China. Option C is the right answer. This question has been asked because on page number 3, the Chinese embassy in India carries an advertisement to commemorate the 70th year of diplomatic relationship between the two countries. So this advertisement provides a factual history of the diplomatic relationship between the two countries, and I would kindly request you to go through this once. Now let's take up a practice question from the 2016 prelims paper. Net metering is sometimes seen in the news in the context of promoting the production and use of solar energy by the household consumers. Option A is the right answer. Finally, let's take up a couple of mains practice questions. The first question, evaluate how compulsory licensing helps in bringing down the cost of essential drugs, especially for a country like India. The second question, discuss the maritime dispute between China and Indonesia over the Natuna Islands located in the South China Sea. Kindly write an answer to these questions and post them in the comment section below. So this concludes our discussion for the day. Thanks for watching.